2 months into the pandemic, so what lessons have been learned? I'm joined by Jeffrey Flaks. He's the President and CEO of Hartford HealthCare. Thanks so much for being with us.
My pleasure. Hi, Kara. How are you today?
I'm good. I'm good. That's an interesting question. What lessons do you think we have learned?
My gosh, the lessons have been tremendous. I think we've learned a lot. We've learned a lot about preparedness. We've learned a lot about the essential nature of personal protective equipment and the need to have stockpiles both at a federal, a state, and local level, and within organizations like Hartford HealthCare. We've learned a great deal about putting new processes in place, new practices around infection control and working with our infectious disease physicians around ways to segment different populations within our institutions. We've learned a lot on how to connect with people. I mean, telehealth. To see now, we're at like 180,000 telehealth visits with our patients in the ways that we could be more accessible and connect with people. And lastly, we've learned ways, even when we have visitor restrictions, we've learned the essential and necessary ways to leverage technology to ensure that people are never out of touch with their loved ones. So the learnings have been immense during this process.
And if you were to put it on a scale of 1 to 10, how recovered are the hospitals now?
Well, you know, we're not recovered, and we're not recovered for a few reasons. One, we're continuing to take care of COVID-positive patients every day. So we need to maintain that discipline, that rigor. All of the systems and procedures we put in place need to continue. At the same time, when we think about recovery, we are building back all of the services that were stood down during the first several months of this crisis. So we're not fully restored yet, and the services are coming back, but they're not yet to their peak volumes that they would have been prior to the crisis. And lastly, we're still maintaining all of the apparatus we've put in place. So our forward triage units, the tents we put outside in front of all of our hospitals, those all are being retained because we need to continue to be prepared for a larger second wave. And we have to make sure all of those preparations are continued and supported as time goes forward.
And quickly, before we have to let you go, a lot of people are still afraid to go to the hospital. What do you say to them?
You know, in many ways, I don't think there's a safer place than to be in the hospital. All the protections that have been put in place, every staff member today is screened every day before they enter the facility. Every staff member who works in different high-risk parts of our system are going through routine testing. Every patient who's having a procedure is tested. And the way that we're allocating personal protective equipment and the procedures we've put in place, the protections we've built into our medical group offices are more extensive than they've ever been. So I urge people to work with their providers, trust the health systems, and know that safety first under all circumstances, and that is our highest commitment and priority.
Thank you, Jeff Flaks, for being with us as always.
Thank you, Kara.